Have you ever noticed mood swings that seem to come and go without a clear cause? If so, you might have experienced something like cyclothymia. You might not have heard of it before, so here's what you should know about it. Think of cyclothymia as a milder form of bipolar 2 disorder. In bipolar 2, people experience distinct periods of hypomania, which is a milder form of mania, and depression. In cyclothymia, people experience symptoms of hypomania and depression, but these shifts aren't severe enough to meet the criteria for full hypomanic or depressive episodes. While they're less extreme than those seen in bipolar disorder, these mood changes can still disrupt daily life. Cyclothymia usually develops in adolescence or early adulthood, typically between the ages of 15 and 25, though it can occur at any age, but only affects around 0.4 to 1% of the population. So, what exactly does cyclothymia look like in real life? Cyclothymia is marked by mood swings lasting at least 2 years in adults or 1 year in children and adolescents. These fluctuations involve periods of hypomania and depression. During hypomanic episodes, affected people may feel unusually energetic, talkative, or confident, often taking on more tasks or making impulsive decisions. On the flip side, depressive episodes can lead to feelings of sadness, low energy, and a lack of interest in their usual activities. These mood changes can interfere with daily life, affecting relationships, work, and school. Research suggests there's a genetic link to cyclothymia, meaning it can run in families. If you have a family history of mood disorders, it doesn't guarantee that you'll develop the condition. Environmental factors and personal experiences also play a role. While cyclothymia shares some similarities with bipolar disorder, it doesn't always progress into the more severe form of the disorder. However, cyclothymia is considered a risk factor, and some people with it may go on to develop bipolar disorder later in life. With proper treatment and management, it's possible to manage the symptoms of cyclothymia and prevent it from worsening. While there is no cure for cyclothymia, it can be managed with the right approach. Treatment often includes a combination of therapy and medication. Cognitive behavioral therapy, CBT, is commonly used, helping people identify and change negative thinking patterns that may trigger mood swings. Medications, such as mood stabilizers or antidepressants, can help regulate your mood and prevent the extreme highs and lows associated with the disorder. With the right treatment and support, many people can manage their symptoms effectively. While cyclothymia is considered a lifelong condition, people with cyclothymia can still lead fulfilling and productive lives. Regular check-ins with mental health professionals and lifestyle adjustments are key to ongoing success. Regular exercise, a balanced diet, and good sleep hygiene can play a key role in stabilizing moods. Exercise, for instance, not only helps manage stress but also boosts overall well-being. In addition to maintaining a steady routine, incorporating stress management techniques such as mindfulness, deep breathing exercises, or time management strategies can further reduce the frequency and intensity of mood swings. By taking a proactive approach to managing stress, you can create a foundation for emotional balance and resilience. Horizons Addictions and Mental Health Services offer a multidisciplinary approach to treating individuals with persistent mental health conditions. Our team of specialists can help guide New Brunswickers to the right care, connecting you with the appropriate clinicians and services. Cyclothymia can be challenging, but it doesn't have to limit your potential. With proper treatment, care, and support, managing this condition is entirely possible. If you think you may have cyclothymia, it's important to consult with a healthcare provider for an accurate diagnosis and a personalized treatment plan.